More on this, Dr. Bharat Pankhania joins me now from Bath. He's a senior clinical lecturer at the University of Exeter. Doc, thank you so much for your time. Really appreciate it. Just take us through these antibody tests. I mean, how reliable are they, and are they absolutely necessary in this fight against COVID-19?
Thank you for inviting me. The antibody test basically looks at the presence of antibodies to show that you have survived a coronavirus COVID-19 infection. That is all it shows. And you usually do this test about 20 days after the infection. So by that time, the immunoglobulin G levels have gone up, and you do a blood test and it detects its presence. What we are not sure about is, does that mean you are now immune? If you are immune, does it mean you're immune forever? For 2 months, 3 months, 6 months, a year? We don't know that.
Yeah, there's so many questions surrounding this virus that people are looking into, and so much uncertainty. But there are several countries obviously wanting to end the lockdowns because of the terrible economic impact that's now being felt. And now with the mass production of these antibody tests, should governments really be pinning their hopes on these types of tests, or should it be a more multifaceted approach?
Oh, without a doubt, a multifaceted approach. Absolutely. So we need to remain neutral, and we need to be aware that multifaceted approach will be helpful. Some actions will be good, some actions will be wrong. But to use the English phrase, we do not put all our eggs in one basket. We got to be very careful with infection control, finding medications, finding vaccines, and controlling it. So multifaceted, absolutely right. That's what we should be doing.
And doctor, is there a danger of a possible second wave based on governments doing these mass antibody testing, then deeming possibly that certain parts of the country are safe because people have had the disease, and then they ease lockdown measures, and then when things return to a sense of normality as much as we can understand, there is then a second wave of COVID-19 infections?
Yes, that is plausible, and that is what we need to be very careful about, because if we do not produce immunity, then you can get subsequent infections. Also, once you relax control measures, inevitably transmission of infection happens. Therefore, lockdown should be very, very, very carefully undertaken. And even after the lockdown, you exercise good infection control, hand washing, and maybe wearing masks in public places is also an example of a controlled, multifaceted approach.
Doctor, when it comes to just the testing for COVID-19, you were recently quoted in a New York Times article saying the number of people tested is meaningless. If you fail to deliver on contact tracing, then you are testing as a ceremony rather than as a way to contain and isolate the outbreak. So with all of that in mind, should governments actually still be putting more resources towards testing for the actual virus, as opposed to spending money and producing mass testing for other tests like the antibody testing?
Very good question, and I stand by what I said in the New York Times. What I am saying there is, unless and until you test, and at the same time you contact trace. So you need testing and isolating positive cases, and then you immediately contact trace. So you identify people who have got the infection, you identify the people who are contacts of that case, and you remove both from circulation. So really, you have to do both rather than one followed by the other. Otherwise, as I said, it's just a ceremony.
Okay, we'll leave it there. Dr. Bharat Pankhania, really appreciate your time. Thanks so much for joining us on TRT.